Hello and welcome to Rajya Sabha TV. You're watching COVID-19, India Fights Back. I'm Teena Jha. India has crossed a significant milestone in its fight against coronavirus. The national recovery rate has crossed 96%, which is one of the highest globally. The active cases have drastically declined to 257,000. So at present, the total positive cases in the country comprise merely 2.51% of the total cases. However, the new strain of the virus that was reported in the UK has caused a bit of concern due to its highly infectious nature. So far, 25 people in the country have tested positive for the new UK variant genome of SARS-CoV-2. So what measures are being undertaken to contain the spread of the new strain of coronavirus? What precautions people must take to keep away the infection? And how are we preparing for the vaccine rollout are some aspects we will be talking about on the program today. We're being joined by a very special guest to put things into perspective for us and our viewers. We have with us Mr. Rajesh Bhushan, Secretary, Ministry of Health and Family Welfare, Government of India. Welcome to Rajya Sabha TV, sir.
Thank you for having me here.
Sir, the year 2020 has not been good for the entire world. We've been battered by the coronavirus pandemic. Initially, there was a lot of fear that the virus may wreak havoc in India, given our huge population. But as we speak on the last day of the year, India has not just managed to contain the pandemic effectively, but also report the highest recovery rate. So as someone who's led the charge during these unprecedented times, how do you assess the year gone by in terms of India's fight against the pandemic?
The year 2020 was a year of challenges for the public health system. It was also a year of resolve, a year of collective resolve, which showed that as a nation, if we decide to work together and if we work in a well-directed, united manner, then we can convert such challenges and such dangers to public health system into an opportunity. So more than challenges, it was a year of resolve where we showed that a whole of government and whole of society approach can be used effectively to tackle the pandemic. So we have learned lessons, and going forward, we would be looking at strengthening our public health systems, both in the rural and urban areas, strengthening our disease surveillance system and our diagnostic services.
So, sir, now that we are at a stage where we have sort of surpassed a significant milestone in our fight against COVID-19, if we look back, what according to you have been the factors in these past few months that have helped us in dealing with the pandemic?
There have been multiple factors. The first important thing is that we, as I told you, that we have adopted a whole of the government, whole of the society approach, which means that we have looked at pandemic management not as the responsibility exclusively of the Union Ministry of Health and Family Welfare, but as a joint initiative and collaborative effort between multiple ministries of Government of India. For example, Health Ministry, Home Ministry, Commerce Ministry, External Affairs Ministry, and other associated ministries and departments have all worked together to tackle the pandemic because it was and it still remains a multifarious challenge. So therefore, you require participation of other ministries. Then we also realize that the cutting edge level or the implementation level is in the states and the UTs. So while the Union Ministry of Health and Family Welfare issued various SOPs or standard operating procedures, multiple guidelines, we also made sure that the states and the UTs are trained to implement these SOPs and guidelines. So that is another example of whole of government approach. We realized that community connect or participation of the community in whatever we want to do, whether it is containment or surveillance or quick testing or treating the symptoms immediately, ensuring that hospital admissions happen, all this requires a continuous engagement with the community, with private sector. So that was also done. So in the end, it remains a collaborative effort. It remains an effort which is well directed, and it remains a sustained effort.
Definitely, and it perhaps because of this approach that we are here. So, sir, after a year now gripped by the pandemic, the new year certainly looks very, very promising amid high hopes of a vaccine rollout as well. Particularly with the government having ordered 83 crore syringes, the hopes are soaring high. Are we ready to begin the new year with a vaccine, sir?
See, before we talk of the new year, let us also put things in perspective. The year 2020 has not been all that bad. From mid-September, we have seen a sustained and continuous decline in
Yes.
number of cases. This has happened when the world, the countries elsewhere, look at the countries of the Western world, look at Americas, look at Africa, all these countries, even certain countries of Asia, they are seeing again multiple peaks. Whereas in our country, because of the support and the collaborative effort, where everyone has extended a helping hand, we have seen our cases decline, we have seen our death rates decline, we have seen our positivity rates decline. So, therefore, the year 2020 is not a year which will not be remembered for some of our good work and some of the work which was achieved
Certainly.
among very, very trying circumstances. So that must be kept in mind. Now, going ahead, in the new year, obviously, we hope that a vaccine would become available. As the Honorable Prime Minister has said, that it is in the near future. And once the vaccine is available, we do have an operational plan of rolling it out across the country, which is being shared with the states and UTs, and necessary trainings have been imparted, requisite dry runs have been done, and we are quite hopeful.
So, sir, what is the strategy that we are going to adopt going in for a smooth rollout of the vaccine as and when it's available?
The union government decided that such a large scale vaccine rollout must be guided by an expert group. So, therefore, in August, the union government established a national expert group on vaccine administration, which is popularly called the NEGVAC. It is chaired by member Health, Niti Aayog, and co-chaired by the Union Health Secretary. It has stakeholder ministries and departments. It has representation from states. It has representation from the scientific community, even outside government. And it has a very clearly laid down mandate. And one of those mandates is to prioritize population groups which will be receiving this vaccination whenever it is rolled out. Because in the initial stages of vaccination, the supply of vaccine would be limited. But the population that needs to be vaccinated, that's the vulnerable group, that would be more. So therefore, there is a need for prioritizing groups, saying that this group needs to be protected first, followed by this, followed by this. So the NEGVAC has prioritized the population groups. NEGVAC has also said that this prioritization is not necessarily sequential. In case the vaccine availability improves, some of these groups, the priority groups, can be taken together rather than one after the other. So this is also an important thing to keep in mind. And you also need the logistics to be in place for such a large scale vaccination to be successfully carried out in the country. And those logistics basically involve adequate number of vaccinators, their training, then adequate number of cold chain equipment and storage points, and adequate number of people to be trained in different aspects, right from procurement of vaccine to storage of vaccine to transportation of vaccine to organizing vaccination sessions, actual administration of vaccine, and then observing for adverse events. So we have issued comprehensive operational guidelines for the states which cover all these aspects.
So to ensure this very thing, a pan-India mock drill is going to start from the 2nd of January. Earlier, also a dry run was conducted in 4 states. Tell us, how did it go about? Did it meet the objectives for which the dry run was carried out?
Dry runs. We require these dry runs because for the first time, we are trying a adult vaccine. We have experience in this country of universal immunization program. In fact, our experience goes back decades, and every year we immunize roughly 2.70 crore young children against 11 vaccine preventable diseases and 2 more diseases which are selectively done in a limited number of states. So 13 vaccine preventable diseases year after year. So that experience we have. But these are young children and pregnant mothers. Compared to the universal immunization program, for the first time under COVID immunization, we would be inoculating or immunizing the adult population. So that's a major change. The second change is that we are doing it on a very large scale. I just told you 2.70 crore young children every year. Here in COVID immunization, we are talking of 30 crore population in the first 5 months of immunization. So that kind of logistics has its own challenges. So these are 2 major differences from the universal immunization program that we do every year. So because of these differences, it is necessary to do multiple dry runs across states. Problems in Punjab are different from problem in Assam. Problems in Gujarat are different from, say, problems in Andhra. So in the first stage of dry run, we decided that we would choose 4 states in north, south, east and west of the country. And we chose Assam, Punjab, Gujarat and Andhra. And we did a dry run there. And now, coming Saturday, we would be having a dry run in all the states and UTs of the country in selected districts. So it will be a one-day exercise to test all our systems.
Okay.
Another very important thing that I want to highlight at this point in time is that for the first time in the country, we would be using a digital platform, COWIN, COWIN, to track the entire vaccination exercise. So this application or this digital platform tracks the vaccine from the time it is procured and how it is stored, under what temperature it is stored, how it is transported from the storage point to the vaccination point, how are individual beneficiaries vaccinated, so their names. So each individual beneficiary is tracked, and then each individual beneficiary is intimated through an auto-generated message that the system generates about his inoculation status. For example, the COWIN system tells the beneficiary that on such and such date, at such and such time, at this venue, you are supposed to be present, where you will be vaccinated by vaccinator's name. They also provide you the name. And then on the appointed day, the person goes, the beneficiary goes to get vaccinated. And then if there is some adverse event, because there are adverse events associated with even conventional vaccines, this one is a new vaccine. So that also gets reported onto this digital platform. And eventually, when both the doses of the vaccine are given to the beneficiary, he or she gets a digital certificate through the system, which is QR code based. And the beneficiary has the option to keep that digital certificate either in his or her mobile phone or in the Digi Locker. which is a secure facility offered by the government free of cost. So there are multiple operations that this digital platform is providing. Therefore, there is a need that you need to see how this digital platform performs in field conditions. So this is the context in which these dry runs are taking place.
So, sir, the manner in which we are gearing up for the vaccination rollout, do we have a time frame in mind when we actually will start implementing the vaccination drive?
You see, we have already shared multiple times at all available forums that in the first phase, we are looking at vaccination starting somewhere in January till end July, early August. That's the first phase, which will cover roughly 30 crore prioritized population. So that's our first aim. And then going ahead, as we formulate further plans, we would be sharing them with the people as well as with the states and the UTs.
All right. So, sir, while the vaccine, offers high hopes in the coming year, there is also a challenge that we are staring at currently. One big concern at the moment is regarding the new strain of the coronavirus which has entered our country. So far, 25 cases have been reported of the new variant. How serious, according to you, is the new variant, and does it warrant additional measures in order to prevent the spread?
You see, government, both the union government as well as the state governments have acted in a proactive manner and in a preemptive manner. So, what have we done in this proactive, preemptive approach? We have consulted regularly with the two domain knowledge expert committees. The first committee is the JMG, the Joint Monitoring Group, which is headed by the Director General Health Services in the Ministry of Health and Family Welfare. And it has scientists, it has public health people, it has epidemiologists, so on and so forth. The second committee is the National Task Force on COVID-19, which is headed by DG ICMR and member Niti. That committee also has scientists and domain knowledge experts. These committees have told us that mutation in a virus is a natural phenomenon. So that is the first important thing to remember. So whenever a virus mutates, there are two concepts. One is a concept of virus shift and other is a concept of virus drift. So virus drift are natural mutations, maybe one or two mutations every month, but they do not have serious implications from the public health point of view. However, the second concept of virus shift as distinct from drift, virus shift means that there are multiple rapid changes in the virus, and these multiple changes either make the virus more infectious, that is, its transmissibility increases, or make it more dangerous in terms of mortality. The present evidence that we have in respect of the UK mutant virus is that it has a higher transmissibility, but there is no evidence to indicate that it has higher mortality. So in this context, we have temporarily suspended the flights originating from UK into the country, and we have also ensured that all UK returnees are subject to RT-PCR test, and those who are found positive, their samples are sent to designated labs for genome sequencing. Because without doing genome sequencing, you cannot establish whether the person is positive because of the mutant virus or the normal virus.
Yes.
So that has been done. And so far, we have found only 25 persons with this mutant virus. All 25 have been physically isolated in medical facilities, and their close contacts have been tracked and traced, and they are also getting tested.
But I think, sir, what's worrying is that a number of people who've returned from the UK are not cooperating with the administration. They're either giving wrong information, switching off their mobile phones, and therefore they're not being able to be traced. How big a problem could that be, and what is being done in this regard?
You see, these are routine problems. They often happen, but you would have realized if you are following the news closely in different media, platforms, that the state governments are working very hard to track and trace these people. And we do hope that people are intelligent, they are sensitive, they are responsible, and they would cooperate with the governments. And so far, we have not encountered any insurmountable hurdle.
Okay. So, given the highly contagious nature of the new strain, what precautions would the Ministry of Health advise people to take in order to keep away from the infection?
You see, our advice is more of the same, but to be done in a more efficient manner. So, what do I mean when I say more of the same? It means that you must maintain physical distance, 2 gaj ki duri. You must, in all public places, wear masks. You must wash your hands multiple times with soap and water and use sanitizer. If you see any symptoms in yourself, you must, without any hesitation, get yourself tested, because now there are testing facilities which are easily available and no doctor's prescription is needed. And in case you have symptoms, you must isolate yourself. So these are some things that we have been stressing again and again, and we keep on stressing them as we go into the new year. We also stress the fact that we are in the winter season, and winter season is relatively more amenable to such viruses. So therefore, people need to adhere to the COVID appropriate behavior and observe all precautions.
Also, sir, the New Year celebrations have kicked in. What measures are we undertaking or have undertaken already to ensure that New Year events do not turn out to be super spreader events?
You see, the Union Home Secretary had issued detailed directions in this regard to the Chief Secretaries of States and UTs, and thereafter the Health Ministry, the Union Health Ministry, had reiterated some of those directions, and we had advised the states that based on local circumstances, if they feel that there is a need to impose certain localized restrictions, including night curfew, they must do so, because this is a deterrent for events and celebrations where a large number of people would gather, which can then prove fairly dangerous from the public health point of view.
So one final question. The Prime Minister says that if 2020 was a year of health challenges, 2021 is going to be of health solutions. And in that aspect, India's contribution is going to be very, very significant. So how do we intend to contribute on this front largely when it comes to the global order, sir?
You see, as I told you right in the beginning, that the collective resolve of the nation converted this huge challenge into a huge opportunity. And going ahead, we would build on whatever capacities that we created in 2020. For example, when we began this fight against COVID, our ability to domestically manufacture ventilators or personal protection equipment or N95 masks was abysmally low or almost absent. But we created something from scratch. And today, you would be surprised to know that we are even exporting these items. We are exporting personal protection equipments, we are exporting N95 masks, and we have permitted the export of ventilators. In the last 11 months, almost 37,000 ventilators were made in India and were provided to government hospitals. And equally important is to note that from independence to pre-COVID times, our government hospitals across the country had only 16,000 ventilators, 16,000. And in 11 months, the country showed resolve and it supplied 37,000 ventilators. So there is no comparison. So this is the kind of manufacturing capacity that will be augmented going ahead in the next year. Similarly, we have multiple vaccine manufacturers in the country, and sooner rather than later, their multiple vaccines will get approval of the regulator, and they would also be in a position to fulfill the domestic needs and also export outside.
Certainly. So while 2020 has been a year of pandemic as well, but for India, it has also been a year of resolve, as pointed out by the Honorable Health Secretary. Thank you so much, sir, for joining us on the program. Wishing you a very happy new year and good luck with the vaccination drive in the coming year. Also wishing all our viewers a very happy and prosperous new year as well. But before I wind up, I once again want to remind and urge all our viewers to stay safe from the ongoing pandemic. Wash your hands, face regularly, wear masks whenever you step outside, and don't forget to maintain physical distancing. Remember, these simple precautions by you can help you defeat the pandemic. That's it from us on the program today. Thank you very much for your time.